Good morning, good afternoon, good night. Whatever time you're joining me today, I want to welcome you. Welcome to Hands for the Aged Tutoring Services, where we train and tutor persons to become the best version of themselves. In this video, I just want to introduce you to the long road ahead. It is treacherous. It has a lot of pits and falls, gullies and mountains. It has the good time, it has the bad time, it has the not so good times. It has the time when you feel like you're deceased. But I promise you, you're going to stay the course. You're going to be very good at what you do. You're going to find the topics very, very interesting. So stay with us. You have met me before online during all of the live sessions and all of the video clippings that you have seen on TikTok. This is me. My name is June Lewis. I am the founder, the chief coordinator, the face of, and one of the facilitators at Hands for the Aged Tutoring Services. Why Hands for the Aged? Because we cater to all ages. Whatever your age, we cater to you. We cater to the needs of everyone. We are aware that health care is important, and so we are bringing it to you in the comfort of your own home, in your own time. There is no reason not to do your very, very, very best. We kick this session off by saying to you, our WhatsApp number is 779-9369. You can reach out to me within reasonable time. We offer practical caregiving courses. We're doing the home health aid, and that's a 12-week course. The geriatric nursing skills, and that's for 6 months. The nursing and kindergarten care, that's for 6 months also. And then we have the longer form patient care assistant course that runs for 12 to 15 months. Why so long? Because we are preparing you for the one-off assessment by Heart NSTA, where you've been successful, which I'm sure you will be awarded Allied Healthcare Assistant Level 2, and that is the NCT vet certificate that everyone is asking for. Because why? Persons want to make themselves very, very marketable. We are not training persons just for the local scene, but we want our students to be international. Again, my name is June Lewis. You'll be seeing my face often. I am only one of the facilitators at this noble entity. So sit back, relax, let us enjoy the ride together. So there's a bit of information there, and there is also a book. This book, Hands for the Aged Tutoring Services, it's a past paper booklet. In this booklet, let me bring the camera just a little bit closer so that you will be able to see better. All right. So this booklet, we are carrying the past papers for 6 subjects that you will do as part of your course. Not every course will be doing all these subjects, but persons who are doing the longer form PCA, yes, you will be required to be doing these 6 subjects, and this is only 6 of the 12, all right, that you will be doing. All right, so we kick things off this morning with the history of the profession of nursing. In your book, you will have history of the profession of nursing. You will be having the notes for that, all right? In this one, we have the past papers, and so we'll be taking a look at some of the past papers. And so we have here Introduction to the Profession of Nursing, Past Papers 2024, Course 1001, Introductory, the Profession of Nursing. All right, so we do introductory courses. Don't leave and say, oh, I am this nurse and that nurse and that nurse. No, we're only doing introductory subjects to the areas of learning, the skilled areas, right? So you will need to be doing further training as you go along. So today we're going to look at a couple of the questions here in this book that we will need to focus on as we go through our studies. And so one might ask us, really, who is a nurse? Who really is a nurse? Ask yourself, who am I? And decide on the most suitable and appropriate response to that question. In my professional field, who am I? You first need to answer that to yourself, and then persons might ask you, who are you professionally? And when you say, well, I am a caregiver, I am a nurse at my level, I am a nurse in this field, I am a caregiver. I have been trained and certified to carry out the duties of a nurse. You have to know who you are. And so whichever phase of nursing you are in right now, and you had not answered this question to yourself, this is a good time to answer the question. You're saying, I am a professional, I am a nurse. But what are the criterion of a professional? Those are questions that will be posed to you as a nurse. Oh, I'm a professional. And person saying, oh, you're not behaving professional. Then you have to ask them, no, what do you mean? Who is a professional? Who am I? I am a professional in the field of healthcare. Specifically, I am a this, I am a that. But what is the requirement? What qualifies me to be saying that, or I have the authority to speak as a nurse? We have to answer that to ourselves. Because we're doing the history of the profession. The history started a long time. We know that history is history, where it all began. So you have persons, Chinese, the Indian, people in Palestine, right? People in Babylon, Assyria, Jesus the Christ of Nazareth, and all of that. Nursing came up over time. You'll be asked, who is the founder of Chinese medicine? And why Chinese? Because everything we said start in China and it's gonna end in China. That's the saying these days. Everything is Chinese. So who was the founder of Chinese medicine? Is that important? Yes, because Chinese do good research and they have shared information with the world from that time. Who is considered to be the founder? Where did it all begin and with whom? We have learned over time, during our early years of schooling, education, we have all heard of Florence Nightingale. And it seems that she's a household name. Everybody knows of Florence Nightingale. But what do we know of Florence Nightingale? Where was she born? Where was she educated? What was her contribution to this noble profession? We speak of Edith Cavell. Who was Edith? Right? There's our own Mary C. Cole. And many of our children will be residing on the Mary C. Cole Hall. Where is that? What were their contribution to nursing? Have you heard of the Crimea War? What is it about? How does the Crimea War fit into all of what we want to be doing as nurses? Why is it important that we at least have an idea or a little knowledge of what it is about? We might not remember what it is in its exact terms 3-4 years down the road, but we will be aware of the Crimea War and how it impacted us as nurses. So we want to be reading a little bit about that history. In these days, nowadays, our males, they do not want to be nurses, and especially here in Jamaica, they are stigmatized, they are pushed aside, they are disencouraged to be nurses. But in the past, in India, the ideal nurse was a male. Yes, very much so. The ideal nurse was a male. And so these days, the tables have turned. And the males are shying away from this noble profession. And especially here in Jamaica, we do not have many of our males be nurses. Other countries did help and is still helping other countries to develop their healthcare facilities and healthcare programs and hospitals and all of that. So there are other countries that do help in the development of nursing and medicine in other countries. So we would ask, who was responsible for the development of medicine in Rome? Right? Who? We have read in the Bible, we talk about Rome, we talk about Assyria, we talk about this place and that place and the opposite place and all of that. But we just talk. We talk about these places as though we have lived there and we know them. But truth to be told, we know nothing of these places, do we? No, we only read about them in the Bible and we are expressing our thoughts as though we take a bus and go to Mandeville or we go downtown Kingston to the market. That's how we're treating what we're reading in the Bible. But the Bible tells us a lot of things about the past. It is history. We will talk about other persons who were very, very important in development of medicine and caring for the poor. We're talking about Nurse Fabiola, we're talking about Marcella, we're talking about Florence Nightingale, we talk about our own Edith Cavell, we talk about Mary C. Cole, and there are many others. Right, so we talk about many of them, and so we will do some research about them. In the early days of the churches and all of that, They were nurses, but these persons were not referred to as nurses. They were referred to as nuns. And in the Catholic field, I think they have the monastery. I don't know if females are in monastery or there's a different, that's just for the priest. But there are places where nuns are even today, especially in the Catholic faith. We'll move on to the Kingston Public Hospital. We want to know when it was opened. Everybody knows about the Kingston Public Hospital. What is the history of it? The real gruesome history of it. When it was first developed, it was not known as the Kingston Public Hospital. It has another name. And the name it had is not even so bougie, you know. It was for lunatics. So we have to have a little knowledge about that. And the matron who was there and all type of atrocities that happened, why she was dismissed and so forth. We will talk about that when we talk about ethics in nursing. And what was she guilty of? Which of these ethics were breached during her reign of terror? And who really called her out? Which person who was in the care, who would say a patient at the hospital, who reported her doing, who kept a diary that helped to really relieve Judith Ryan. She was the matron at the time of the lunatic, the female section of the KPH. Then I said it was not the KPH, it was some other name that we will talk about. So it was a patient who kept a diary of the happenings that really caused the demise of Judith Ryan then. So we can call out in any situations that we can speak up and then change can happen. So who was Anne Pratt? And how does she fit into our lives, our careers as nursing? Who was Anne Pratt? We have to find out who that person was. All right, so we have the board up. History of the profession of nursing. And we want to ask ourselves, who is a nurse? Who is a nurse? Ask yourself, who am I? All right? You're a nurse? Yes? You need to answer that question to yourself and keep that definition of you in your mind. Who is a professional? All right? What terms would you use to describe yourself as a professional? It's can't when person asking you so, you say, oh, I. You need to know up front who you are. The name Florence Nightingale, the name Mary Seacole, and others that you will read about in your book, how are they important in shaping your life or your decision? How did they help in your decision-making process to walk the street of a nurse? The Crimean War, which we spoke about earlier, how is it important? What is the importance of the Crimean War to the nursing profession? We want to know what was the original name for the Kingston Public Hospital. What was it? When was the KPH opened? And again, you see the name Anne Pratt coming up. Who was Anne Pratt? When we speak of the lady with the lamp, who really are we talking about? When we talk about the lady with the lamp, who really are we talking about? When we talk about the yellow woman with the cholera medicine, who are we talking about? You have any idea? These are some of the questions that we answer, and these are some of the things that we talk about, and we want to, talk about the history of nursing. We don't just jump in and just talk about, giving vital signs and giving this and doing that and all of that. No. Where did it all begin? Who were these people? I am reading from the question book. So I'm looking at some of the questions that are here, and these are what we're talking about. When we're talking about the yellow woman with the cholera medication, when you see the word cholera, you have to stop it now and ask, okay, what is cholera? You're not just gonna call the word and pass them over. You will now have to stop and pull out Google or pull out your child's dictionary if they still use dictionary in school, I don't know, and look up the word cholera and to see what it is. Then you'll have to go further and maybe research what was the impact of cholera on a population, maybe Jamaica, maybe Cuba, maybe Venezuela, Guyana, someplace in the US. How did it impact the lives of persons? And what role did Mary Seacole play in this whole cholera situation? The history of the profession of nursing also takes into consideration a lot of nursing ethics. Many of us like to be sitting and discussing patients and all of that. But there is a time and place. There is an appropriate time and place to be doing these type of discussions. So the question that the examiner had asked, what is the most appropriate time to discuss a patient? What is the most appropriate time to discuss a patient? You will need to determine that and keep that in your memory. So again, as we are reading from the past paper booklet. In our reading, in our booklet, we'll come across terms like leprosy, quarantine. What do those terms really mean? What is leprosy? What is meant by the term quarantine? Pandemic, we came across this word so often. Isolation, quarantine. Yeah. But then we just call those words and we didn't stop to figure out what really do these terms mean. What? So this is the time as a nurse that we are going to take time to invest in our education. We are no longer just going to call words as we see them and pass along. No. We will now have to stop and consider and contemplate the meaning of these words and to think back if we have come across any situation that these words are referencing. Because we're talking about the history of nursing, then we have to talk about what used to happen back then. When we had no hospital, we had no medicine, had not developed the way it is. So it was a lot of magic and spells that were used for healing. And then you have the god of healing. You have the founder of Chinese medicine. You have the greatest medicinal man, the god of healing. And oftentimes, our persons got information about healing or what work or what doesn't work is that when a person who had been sick, they were placed outside the gates of the city. In the Bible, we talk about many gates of cities and all of that. So I assume that a city was actually a specific place with a gate. I don't know. All right, so these sick were placed outside. So say, for instance, in our days now, they probably put at the entrance of the lane or so. That means when persons are passing now, they will be able to see the sick out there. So family members might have brought their sick to the entrance of the lane or street or to the church or the synagogue or somewhere. Then persons who have probably had that sickness or experience with that illness would have said to persons, oh yes, my son, my daughter, myself, my wife, somebody in my household, somebody I knew had this particular type of sickness. And this was what we did. So that was part of the whole passing of medicinal information, passing of treatment information. So that was in the old time days. So you had God of healing, God of the stars, God of fertility, God of this, God of that. So it didn't just have... When we read about these things or hear about these things now, they are not new. They are all part of the history of our being. Again, I want us to look at the board. Remember, we're doing history of the profession of nursing. And so, at this point in time, I want to ask you, what are some of the fundamental responsibilities of a nurse? What are some of the foundational responsibilities of a nurse? We have these acronyms WHO and PAHO on the board. You will have to decide what are these acronyms representing. Write it in your notebooks. At the end of the session, your notebook should have a lot of information in it. WHO and PAHO. We will be coming across many more acronyms as we go along. Remember, we are doing the history of the profession of nursing now. I told you before that in the past you had God of healing, nurse of this, nuns of that, and so forth. So who was considered as the God of healing? Who? Who was Imhotep? Who was Imhotep? So we have who is the God of healing twice. Remove the second one and write the word Hippocrates. Hippocrates. Okay? All right, so we have the acronym WHO and also PAHO. What are the meanings for these acronyms? We said before that in the past, historically, we had many a gods of this, many a god of that. There were different ways in which medicine and nursing and treatment were dealt with at that time. So, the question that the examiner is asking you, who was considered as the god of healing? Then another question was, who was Imhotep? Who was Imhotep? Another question, they're going to ask you something about this person, Hippocrates. All this information is in your notes. So there's no need to be pulling your hair out. So these are things that you're going to read about, or persons you're going to read about. What do we really mean when we say someone is healthy? A state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And we want to know which of the entities above or beyond or somewhere else had referred to or defined health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Because once the person is not in bed, we can't see anything physically wrong or mentally wrong, we consider that the person is healthy. But one of these organizations, whose acronym is presented above, has given us their breakdown or their definition of health. We have learned about Henry Morgan when we study history and when we talk about the pirates and all of those persons. Henry Morgan is important in the history of this profession because he was a buccaneer. We learned about him during our study of maybe history or civics. I don't know which one, right? But the name Henry Morgan we have come across in our studies. So we want to know at this time, what was his cause of death? Henry Morgan, what was his cause of death? So Henry Morgan, the great buccaneer, we all studied about him. We learned about him, when he born, when he dead, what was his occupation. He was a pirate, he was a buccaneer, he was this. We don't even know what buccaneer means, you understand? But we read about him. But then here he is now coming up in our professional life. So we want to know now, Henry Morgan, what is your claim to fame? All right, that you are now turning up. And his claim to fame, as far as we in the medical or the health field is concerned, we want to know, what was your cause of death? So we're asking the man, what killed you, bro? What took you out? So that's one of the questions that is in your book. Henry Morgan's cause of death was, that was question number 30 in your book for persons who are doing the patient care assistant and has the history of the profession notebook. That is number 30 in your book at this time. Then we see this nice word, euthanasia. Euthanasia. What does that word mean? That is a question that is asked in this book. The specific question says, Nurse Johnson is caring for patient John Brown, who is terminally ill and is in much pain and suffering. He asked her to advocate for euthanasia on his behalf. Which of the following action is inappropriate? That's number 33 in your question book. For persons who are doing the longer form patient care assistant course, you do have a notebook that carries the first subject, history of the profession of nursing, and that is what we are discussing here today. For persons who are doing other courses, this might not be one of the foundational courses for you, all right? But the knowledge is important, and you might pick up one or two questions from it in your exams. So listen, you might not have a book to study. You might pick up one or two questions. But you will know what questions are coming so that you will be able to prepare for them. At this point in time, we are moving along, and so we're coming now closer up. And so as the profession develops, then things have to become standardized. Persons in Jamaica has to be practicing at the same standard as persons in London, somewhere in the US, in Belize, in Trinidad, in Barbados, in Guyana, wherever. So they say, listen now, Jamaica can't be doing its own thing, and the US doing its own thing, and Syria and all those places doing their own. So we have to put all of things under one umbrella. So they're saying, all right, let us come up with a code of ethics for nurses, an international code for nurses, code of ethics. What should we do? What should we not do? What things are acceptable? What things are not acceptable? An international code of ethics. And then in the International Code of Ethics, separate and apart from all those maybe 19, 20 things that they have listed that we have to abide by, they went on further now to include the society and how we will behave according to our jobs, how we will behave, and there's an extension where they are saying, no, this is how a nurse should behave. So they have nurse and people. How are you supposed to behave with people in general as a nurse? How are you supposed to behave as a nurse on this professional street? How are you supposed to behave with your co-worker? So they have outlined ethical codes that we have to follow. Nurse and practice, nurse and co-worker, nurse and the profession, nurse and people. And they are asking us questions here about those ethical principles. One of the questions that is asked, question number 35 in our books, is saying, Nurse Thompson saw a co-worker, and it is gonna be happening with us. So listen carefully. So you are working and you see your co-worker preparing to give a patient, call the patient hot cover. So you and Nurse Simpson are working. All right? And Nurse Simpson is preparing to give pot cover the patient medication. The dosage is above that which was prescribed by the physician. What should you do? What is your responsibility? Your co-worker is preparing to give the patient a dose of medicine above that which was prescribed. What is your responsibility to the profession and to the patient? What would you do? So let us continue the question as it is in your booklet. Nurse Thompson saw another co-worker preparing to give a patient medication above the prescribed dosage. She rushed to her supervisor and informed her as to the action of the other nurse. This is considered an example of which of the extended code of ethics? Nurse and practice, nurse and co-worker, nurse and people, nurse and the profession. Which one of the action you took by reporting your co-worker to the supervisor, which of the following codes are you protected under? What was your responsibility, and did you carry out that responsibility well? So you were assigned 3 patients. You were to monitor their vital signs, and you were to change simple dressing. Nurse Jones, she is a registered nurse, and she now is above the enrolled nurse, and she is above you, she is above us in our professional field or on a professional level. She's above us. So she now has assigned you the following duties. You are supposed to care for patients A, B, and C. You are to monitor their vital signs, and you are to do some simple dressing. What does this represent? This order that you have given, this collaboration and corroboration between you and the enrolled nurse. Would it be considered nurse and the profession? Is it considered under nurse and her co-worker? Is it considered nurse and practice? Is it considered nurse and people, or none of the above? Which one would you consider it to be? So again, we're doing this course, but we're doing it from the question, because you will now have to go and read its history. There's nothing that I can change nor explain. All we have to do is to answer the questions. So we are going from the question standpoint as we present this introductory subject area, history of the profession of nursing. In Jamaica, we often talk about the Nursing Association of Jamaica. What acronym do we use for the Nurses Association of Jamaica? And when was this Nursing Association of Jamaica formed? When? And why? What is the importance of the Nursing Association of Jamaica? And let me ask the question, who is registered with the Nursing Association of Jamaica? Do they register practical caregivers? That you will have to decide. We have terms that we need to be able to differentiate. And I tell you that some of these, I don't walk around with them in my head. So if you should ask me the meaning of one of them, I said, okay, let me consult with Google. But I know the term, I've come across it oftentimes, and I know where to find the response when I need to. So some of these words or terms that will be important for us to learn, to be aware of, and to distinguish between or among are the word malpractice, the word battery, the word assault, the word negligence. How do you differentiate between what is negligence and what is considered malpractice? We use these words so loosely and interchangeably, but they are very specific in their meanings. So, as we continue, okay. So as we continue, all right, we're looking at some nursing principles. We're looking at nurse and people, nurse and practice, nurse and co-workers, and nurse and the profession. There's a light shining there, but let's work through it, okay? All right, so nurse and profession. Then we have some terms here: malpractice, negligence, beneficence, autonomy, assault, and battery. All of these are explained in your notes. If you have any difficulty understanding what is there, then we can discuss further. So examples are all stated here in a simple form, but as I said, if there is a reason that you're having difficulty understanding, then please reach out to me. Let me ask question number 43. A registered nurse is considering additional education to care for mothers during and after delivery of babies. This nurse is considering what career path? What career path is this nurse considering? Another question. The act of the nurse to do good to the patient is a representation of which of these terms below? Is it autonomy? Is it non-maleficence? Is it beneficence? Is it justice? Right? So these, you will have information in your notes, and this, the persons who are doing the longer term course, the patient care assistant, they do have their textbook that has this information. For the shorter term course, this is not one of the subject area that you will be doing as a subject, but you are responsible for what is also in this video, so you can do your research and then we can have meaningful discussions. We want to be talking a little bit about the Geneva Conventions. I don't know if any one of you have heard about the Geneva Conventions. Geneva is a place in Switzerland, and conventions are held, meetings are held at maybe, I don't know at what intervals these meetings are held. I really don't know. Maybe if we look on Google, we will know when or what time or how often these meetings are held. But they are called the Geneva Conventions, and they have to do with the care of prisoners of war, civilians, persons in the medical field, and all of that. How should they be treated in situations of war? And they have the first Geneva Convention, it's saying so. And then when they meet again, they add other things, and then they meet again and they add other things, and then they meet again and they add other things. So there are 4 titles for these conventions. Much like when you have a theme, like you're having a graduation and there's a theme. All right, so these conventions, they do have theme. What are we going to discuss? What are we going to be agreeing on? All right, so the Geneva Conventions. So we do have questions here. In order to ensure protection and care in all circumstances for victims of armed conflicts, war. When wars are declared and countries go at wars and they have prisoners of wars, they have civilians who need to be protected, they have medics in the field and all of that. There have to be laws that govern how prisoners are treated, how exchanges are made, and all of that. The humane treating of everyone. And so we will read about that in our text. History of the profession of nursing. And here the examiner is asking us, in order to ensure protection, to ensure that people are protected and cared for in all circumstances, order to ensure protection and care in all circumstances for the victims, people who get caught up in these situations of war, in order to ensure protection and care in all situations, all circumstances for the victims of armed conflict, the 1949 Geneva Conventions, what did it do? What rights did it give to medical persons? What right did it give to nurses? That is the question. In the answers, they are asking you, who were they concerned about? That convention, who were they discussing? What did they leave that convention understanding about how persons, victims, which victims should be treated how? What is or are the purposes of these 4 conventions? The Geneva Conventions. We have heard about the Red Cross. And when there are situations, storms, hurricanes, earthquake, all of that, even Jamaica is sending a mission out. We sent mission to Haiti when they have all kind of situation. Even though I think maybe part of our mission is there also. What does the Red Cross signify? We are nurses. What does the Red Cross signify? When referring to the Red Cross, what are we talking about in terms of distinction of race and nationality and male and female and all of that? When referring to the Red Cross, which of these statements apply? The examiner is asking us. They ask again, so important it is that question 50 is reiterating what is the fundamental responsibilities of the nurse. It should be, what are the fundamental responsibilities of the nurse? And then there are some acronyms here. So look here. The examiner is saying to us, write the meaning of the following acronyms. There they are. MD, NAJ, UHWI, KPH, MOH, SERHA, SERHA, PCA, HHA, CNA, LPN, NPRN, and EN. All right? That's what the examiner is asking us. And see, they're coming back to ask us now to answer this question. What are the Geneva Conventions? What is the purpose of the Geneva Conventions? And we have to list in order the titles of the 4 Geneva Conventions. So we have our work cut out for us. We have to do a lot of reading. All right, we have to take time to study if that is what we want. You cannot want a healthcare assistant level 2 certificate just by taking vital signs and chatting foolishness and combing ear and bathing patients. No. It goes much deeper than that. You as a patient care assistant, you as an RN assistant, you as a medical doctor assistant will have to have in-depth knowledge. They're asking us again, I can show you some more. They're asking us about list 4 ethical principles in nursing. Explain one of the ethical principles that you have listed above. List 4 unethical acts in nursing, and you are to explain 2 of the unethical acts. In section 3, they're saying nurses in the past contribute tremendously to this wonderful profession that we are in today. Write an excerpt in not more than 600 words about only one of the following persons: Florence Nightingale, Mary Seacole, or Edith Cavell. You are to include their background, their contribution to nursing, whatever awards and citations they received. And then you are to tell the examiner, how did this person influence your career path? It's a lot, right? And so, I hope that was what you had signed up for. My name is June. I am one of the facilitators at Hands for the Aged Tutoring Services. That was a presentation of our course on the history of the profession of nursing. As time goes by, you're going to be referencing this video for clarity and for preparation. We make it quite simple here. Hands for the Aged Tutoring Services. My name is June Lewis. I am the face of the Chief Coordinator and one of the facilitators at and for the Aged Tutoring Services. We are offering 4 courses at this time. In healthcare, we are doing the home health aide, the nursery and kindergarten care, the geriatric nursing care, and the longer form patient care assistant, which will allow you to be assessed by Heart Trust, NSTA, to be certified as a Allied Health Care Assistant Level 2. That is a 12-month course, and this is one of the subjects that you will be covering in this course or along this path. Take care until we see you again for a face-to-face session. Bye-bye.